Hi, I'm Tori. Today I'm going to CHRISTUS Hospital for a day surgery. I'm having an operation. My doctor said I'd feel a lot better if I had it done. I'm not scared. I won't feel anything. The doctor's going to give me medicine so I can sleep through the whole operation. I couldn't eat or drink anything last night or this morning because the doctor said it might upset my stomach.
Hey baby, you about ready to go? I hope you're feeling okay. You're not nervous about this, are you, Tori?
No, Dad, I'm not a baby anymore. Remember the doctor said at CHRISTUS Hospital there are some really great people who can take really good care of me.
I guess it's just me, but you know, you're still our little girl. Let's go, baby. Come on.
Hi, Tori. Welcome to CHRISTUS Day Surgery. Why don't you have a seat until the nurse comes to get you? It'll only be a few minutes, and you can watch TV if you want to.
A day surgery nurse came to say hi, and she gave me a gown to wear.
I have this special gown for you to put on. I know it's not like your PJs that you wear at home, but it's what we have to have you to wear while you're having surgery at our hospital.
She explained that these gowns are cleaned in a special way to keep germs away during the operation. The bed had wheels on it so they could roll me right into the operating room. Then I saw there was a TV in the room. Hey Dad, turn on the TV. Let's see what's on. The nurse gave me a coloring book that has places to write the nurses' and doctors' names.
Hey Tori, why don't you write down the names of your doctors and your nurses in your coloring book?
Okay.
Nurses and doctors came to the room to prepare Tori and to explain more about what she could expect. They were very patient and answered all of her questions.
Before long, my nurse came to take me to the operating room. She was very sweet. She put a warm blanket over me and got me ready to go to sleep. Once I was in the operating room, she put some round stickers on my chest so they could listen to my heart. Then they put a clip on my finger and a cuff on my arm just like they did in the day surgery room. A doctor called an anesthesiologist is the one who puts you to sleep. He gave me a mask to place over my nose and mouth. Then he asked if I wanted a bubblegum smell in my mask. I said yes. He put the mask on me and told me to breathe just like I normally do. He said I would soon fall asleep, but it would be a different kind of sleep, much deeper than at night. This was so I wouldn't feel anything during my operation. The nurse held my hand, and before I knew it, I was asleep. The next thing I remembered was waking up in a room where other people were waking up too. They called it the recovery room. Nurses were there checking my blood pressure and other vital signs just like before. I told them I was a little sore, so they gave me some medicine to make me feel better. I noticed something taped to my hand hooked up to a bag. It had something that looked like water in it. A tube ran out of the bag and into my hand. The nurse said it's how they put water and medicine in me while they operate. She called it an IV, and they put it on me while I was asleep. I never felt it. Before long, they wheeled me back to my room where my dad and sister were.
Tori, you did great, baby. They said everything went really good.
Yeah, you did good, sis. They gave me something to drink, and the nurse took the IV out of my hand. It really didn't hurt, but I was glad to have it out anyway. The nurse told me that some kids have to spend the night after they have surgery. After their operation is over, they go past the waiting room to pick up their parents. Then they all go to the room where a parent can spend the night too. These kids can play games or watch TV until it's time for them to go home. In a little while, the nurse came in and told us I could go. The hospital was nice, but I was ready to go home and see my mom.
CHRISTUS Hospital is committed to our young patients. We offer a comforting environment that promotes healing and lessens the fear often associated with being in a hospital. Thank you for providing our family the opportunity to take care of your family. Excellent care for patients and their loved ones has been a long-standing tradition for our CHRISTUS nurses.
CHRISTUS Hospital St. Elizabeth and St. Mary are recognized both locally and nationally as healthcare leaders in Southeast Texas. These facilities are among the largest in the CHRISTUS Health System, which ranks as one of the top 10 health systems in the nation. CHRISTUS Hospital St. Elizabeth and St. Mary are among only 3% of hospitals in the country to receive the Magnet Recognition Program from the American Nurses Credentialing Center. CHRISTUS is proud of their facilities, their staff, and the recognition for excellence they enjoy in Southeast Texas.